My name is Christina Olivo, and I'm speaking on post-traumatic stress disorder. Can you imagine what a person having survived the September 11th devastation went through? Have you ever personally been raped or abused? The majority of the country would say no. We can, however, be empathetic to the traumatic experiences one goes through and be ready when they want to talk about it. Now, these are only some examples of traumatic experiences a person can go through in their lifetime. I will be speaking today on the mental stress a person goes through from these traumatic experiences, what currently the U.S. View is on the subject, and how we can change that view moving forward. PTSD is short for post-traumatic stress disorder, which causes anxiety, rage, outbursts, depression, thoughts or acts of suicide, mood swings, personality changes, physical illness from stress, and more. This disorder is stemmed from memories of the traumatic experience being triggered by a similar sight, smell, or sound that brings the memories forward from our preconscious to our conscious minds. It can also affect sleep by reliving the event in our subconscious while we dream. Now, according to T.J. Kozarov, thoughts of these experiences have a habit of involuntarily mixing with current thinking, as well as flashback episodes as particularly dissociative state of mind, while a person behaves and feels as if he or she is in the traumatic situation presently. Also, according to Labash, in these theories, the experience of the trauma is hypothesized to cause hypersensitivity to fear and hyperactivation of fear-related memories. It was Kuker, Spitalnik, Diffiday, Rizzo, and Rothbaum who said in order to treat post-traumatic stress disorder, despite the abundance of evidence pointing to the efficiency of exposure therapy, post-traumatic stress disorder remains a difficult disorder to treat, and identifying alternative treatment options is imperative. In the U.S., post-traumatic stress disorder is related mainly with soldiers and their battle to conform to nonviolent lives at home after being at war, which is especially a big subject with our soldiers coming home from overseas. However, with that said, it's still a general consensus with our society to make these affected groups get over the issue when in reality it's not that simple. What our society does not realize is that post-traumatic stress disorder is caused by traumatic experiences changing the personality of the afflicted, as well as causing psychotic breakdowns or more. The only way to help those who are affected by this is understanding as a community and a society how this disorder affects our minds and be supportive of the mental journey one goes through in order to return to a normal life. People who are affected by this do not just forget or let go of their fears and anxieties related to their trauma. They retrain their minds to stay together even after something reminds them of it. Awareness and understanding is key to changing society's outlook on the disorder and reduce the rates of suicide due to post-traumatic stress disorder. Only then can we help those suffering daily locked in the prisons of their own minds. And so, with the difficulty in treating post-traumatic stress disorder, we as a community need to fully understand and be aware of the effects it causes the afflicted. All of us can do our part in recognizing the symptoms and get help as quickly as possible in a non-aggressive way. Thank you for listening.